Hello there, friends. We are going live today to discuss perineal massage with the OBGYN mom. So give us a minute to get set up here, and we will get going on perineal massage. I'm super excited about this demo. We're going to be posting this on YouTube, and so it's a horizontal platform, and so we turned off commenting because when you have comments, they end up going on top of one of our faces. So that's why. If you have any questions or suggestions, please DM us after the fact. Discussing perineal massage with the OBGYN mom. Do you see the invitation, Brooke? Hello, everybody. Thank you for joining. I'm so happy to see you guys. We're just no worries at all. Let's see. Let's get everything in good position here. Okay, yay. Okay, so I think we're in a good frame position. I can see you well. Can you see me?
Yeah, I can see you perfectly.
Awesome. Well, thank you so much for joining, and thank you everybody out there. We're really excited to have this demonstration. We've been planning it for a while. So
yeah, we have.
It is challenging with busy women and then also being in different countries and different time zones.
And time zones.
Yes, so I'm in Central Texas and you are in London.
Yeah, exactly, in the UK.
Very cool. Good. Okay, so everybody, we're going to give just a brief background about who we are. And before we start that, I want to just reinforce this is general information to increase your awareness of perineal massage. This isn't intended to be specific medical advice for you, so please check with your birth provider. Okay.
Thanks for clarifying that.
Yes, thank you. So I'm a pelvic floor physical therapist, and I've been treating pelvic floor since 2001, and I'm primarily located in Central Texas. And so perineal massage is one of my favorite interventions, and I'm so excited to be able to talk about it.
Yeah, and I'm Brooke. I'm an obstetrician and gynecologist. I work at a hospital in London in the UK, and I work with kind of women in the labour ward delivering babies every day. And also, I'm pregnant as well at the moment, and this is my second baby. And in my first birth, I kind of really looked into perineal massage, that I heard some of the midwives talking about it at work. It's not really something that people talk about so openly, but I'd heard some of them mentioning, this is going to be this is a way to reduce the amount of tears. And I kind of was like, well, why wouldn't I want to try that? And I did it myself. I kind of taught myself because I found there wasn't many resources out there about this kind of topic. And then, I did what I kind of understood to be the right technique. And I had it when I had my delivery. I had a vaginal delivery, and I didn't have any tears. So kind of, it's an N equals 1 study. I'm the only person I know that has done it, but it worked for me. So I feel very passionately. I think we should really encourage talking about perineal massage when it comes to preparing for the birth of your baby, when you're pregnant, and just when you're looking towards delivery at things you can do to reduce the likelihood of you tearing. I think it's great to have some options out there.
Yes, absolutely. So Brooke is going to go over some of the research and the medical side of things, and then I'm going to give a demonstration.
Yeah, absolutely. So what we're talking about here, we're talking about perineal massage. So that is, stretching the area of your body where your baby's head's going to come out of, essentially, because what you don't want to happen is you don't want it to fly out. Yes, there, exactly, that's the perineum. And what you don't want is, when baby's head kind of flies out, that those tissues that are so not used to stretching just tear. And the worst thing that can happen is that you have a tear that extends into your kind of anal sphincters, and that can be disastrous if that happens. And so what we're thinking about here is anything that we can do to reduce the likelihood of tears maybe happening, or even you reducing the need of having an episiotomy as well. And so episiotomy is a cut that's made by the person that's kind of helping to deliver your babies. That might be a midwife or a doctor, and they make a cut if they think that there isn't enough space or stretch within the tissues. And we sometimes make that cut to allow for a controlled kind of tear as the head delivers, rather than an uncontrolled tear, which might result, in damage to your anal sphincters, as I mentioned before. So perineal massage is something that you do when you're still pregnant, when you're not in labour, although there is some kind of there is a role for it within labour, but we're talking here specifically about when you're pregnant, and mainly toward the end of your pregnancy, so from around 35, 36 weeks is when I usually suggest. Do you agree with that kind of timing?
Yeah. Mm-hmm. And that's what I've seen.
Yeah, so around that kind of timing, and then just regularly practicing the perineal massage leading up to when you go into labour and when you deliver. So there isn't a huge amount of studies out there. There's not a huge amount of research, I would say, but there is a Cochrane review, which is actually, you know, I'm sure you agree, one of the best forms of research that we have, when they look at kind of large numbers of studies and group them all together and basically see if we can all reach the same conclusion. And so there is a Cochrane review about using perineal massage when you're pregnant, and essentially the conclusion is that so the statistics, as we say, are around 50 to 75% of women having a vaginal birth will have a kind of a tear that requires some stitches or an episiotomy. And then that goes up to 90% if you include the tears that don't require stitches. So the vast majority of women will have a tear or a cut of some form. And then doing perineal massage on a regular basis, and most of the studies are obviously variable, but most of the studies that they included in the Cochrane review were practicing it about 2 to 3 times a week for women. And that can reduce the likelihood of you either tearing or having an episiotomy by around 9%. So, you know, it's something that you can do to try to reduce that likelihood, you know, of you having a bad tear. And also the women that did practice this technique regularly were 16% less likely to have an episiotomy. So if what you don't want is for someone to need to make that cut down below, then this is something you can do to reduce that risk. But I always say, you know, if your birth provider feels that an episiotomy is a good idea in the situation, I think you should always kind of leave them with that option, because you want to avoid anything that's going to leave you with problems in the future, and episiotomy should help to reduce the problems of that in the future.
Good. Okay.
So that's kind of my roundup of the evidence. Yeah. There isn't a huge amount out there, and I'm, as we said before, we're going to put a blog post up with all this information, and it will have the links to those studies.
Mm-hmm. Perfect. Okay. Yes, and we're recording this, and we're gonna put it on YouTube as well, so it'll be available in multiple places. Great. So now let's get into the perineal massage. So number one, this is a private time. Okay. So I love, in terms of positions, I love the reclining position, because if you think about, let's go over the anatomy here. So here's the female pelvis. We're tilting it down, and we're looking into the pelvic floor from below. Here is the vaginal opening, and here is the anus. And this is the perineum, okay? So that's what we're talking about when we say perineal massage. That's the perineum, in between the vagina and the anus. It's that smooth area of skin. And these pink things that you see are pelvic floor muscles, okay? So you have you have the skin covering it, and then you have pelvic floor muscles right underneath. And so we are trying to massage this area to increase the flexibility and the pliability, so that when that baby exits the vagina, that tissue gives, and it doesn't tear or have to be surgically lengthened. So, okay. All right. So number one, we want to think about our fingers. So we're using our hands, and please, we want to have clean hands and no nails. So this is a sensitive area of the body, and we want to do everything we can to prevent abrasions and so forth. Relax. So we want to breathe and relax. Choose a lubricant that you like. I love coconut oil, but what feels good for you? So choose a lubricant, because we're going to be massaging. And think about any other area of the skin. Yes, you can do a massage without lubricant, but it feels a lot better if you use.
You can get deep into the muscles.
Mm-hmm. Yeah.
And one thing I would also say about the, if you choose to use some of the oils that you find at home, which is a great idea, I think, like coconut oil or olive oil, whatever you feel comfortable. Don't use one like from the kitchen, which you do cooking with, that you might contaminate yourself down below. So just make sure you get a new one, or one that you only use kind of for this purpose. But there are also some pregnancy-specific lubricants, so there's that you can get that will also maybe not be absorbed as quickly.
Okay. Good. So maybe if you have some links to that, you can put up.
Yeah, I'll pop them in the blog,
and then I'll share them in my story too. So we'll give you all kinds of information. That's great. Okay, and then in terms of position, so the pelvic floor muscles are part of your core. And as such, when you're standing, they're having to do work. They're having to lift the muscles. So if you're going to massage your bicep, are you going to massage it when you're contracting? No, you want to try to be in a relaxed position. So I have a little helper here, and I'm in a physical therapy clinic. So we have Barbie, okay? And we want to be reclined. My favorite position is a bathtub because you can recline your body and you have leg support on either side so that the legs are in a relaxed position and the pelvic floor is relaxed as possible. But you can also do it in a bed, so propped up, prop some pillows and prop some legs on either side, prop some pillows on either side of your legs. And again, this is private time. This isn't family time. So if you have obligations, try to do this at a time that you don't have a lot of other things going on. People aren't banging on the door because you want to relax. We're trying to relax the muscles, okay? So now we're going to jump into the perineal massage. I like to start externally, okay? So you have your lubricant, you put your finger here on the perineum, and just gently press. And I also want to say the techniques that I'm sharing are specifically for during pregnancy. So we also do this for pelvic pain and overactive pelvic floor muscles, and there's a little bit of some different instructions that I might give for that. So this is, if you're not having pelvic pain and you're pregnant, this is what I'd suggest, okay? So first of all, just gently pressing in on the outside. And so gently feeling your tissue and becoming familiar with your anatomy, and then you're pressing in. I'm going to use the web space of my hand here to kind of demonstrate that more. So here we are on the outside, and we're pressing in because we have those muscles underneath. So deep pressure, and then you can also go side to side, diagonal the other direction, circles, counterclockwise circles. Again, it's a fairly small area, but you can do a lot in a small area, okay? So once you've done some stretching externally and you're feeling comfortable, let's go ahead and you're going to insert your finger into the vaginal canal. So here's...
How long would you suggest doing that first bit for?
You know, it's really very individual. So a couple minutes, maybe 1 to 2 minutes. I would do more on the inside versus the outside. Okay, so then we're inserting the finger. Now, a lot of times I find that in terms of body mechanics, it may be easier to use your thumb here. If your dexterity allows you to move your finger to put it inside your vaginal canal, that's fine. Whatever feels best for you. But I think a lot of times the thumb is a little bit easier. And so you're going to insert. And if you think about your vaginal canal being like a clock, so 6 o'clock is down here. This is the anus. Here's the vaginal opening, and then here's the urethra opening where it comes out, okay? So 6 o'clock, so we're inserting that thumb, 6 o'clock, and just press down. We're starting gently, give some gentle pressure there, and then kind of do a sweeping motion. So 3 o'clock, so I'm pressing this way now, 3 o'clock, come down, I'm pressing at 4:30 now, 9 o'clock, pressing this direction, and then 7:30. So really you're focusing on that lower half of the vaginal opening here. The upper part, if you press very hard up there, that's your urethra where the peak comes out, that's your pubic bone, and you're kind of smashing tissue against your pubic bone, so that's not going to feel good. So we're focusing on the lower half, like 3 o'clock to 9 o'clock. And you can do
it's also not where the pressure is when the baby comes out, so that's why you kind of... There will be some pressure, but most of the pressure is in the lower part, especially if you're reclining.
Good. And yes, please just feel free to jump in and add anything that I may have. No, I love it. Please, I want this to be interactive. Okay, so a couple different things that you can do here. You can do point pressure, where you're just holding that pressure for 15 to 30 seconds. Or you can do like a sweeping motion. And I really like to do both. So sweeping, point pressure, and again, remembering those different clock positions so that you're getting the different areas. Because if you're only focusing on 6, you're really not, you may be neglecting some of these other pelvic floor muscles here, because you have 17 muscles that make up the pelvic floor. So it's not just one little Kegel muscle. You have multiple muscles that go in different directions and do different things. So generally, we're saying about 10 minutes. And I would say be gentle at the beginning. So you don't want to be sore after. You may feel just a very mild soreness, but if you're having difficulty sitting, or if you cause any skin irritation, or you're not able to urinate or anything like that, like you've done too much. So just gently begin. But then you do want to get a pretty good stretch in there, because if you're just barely stretching, really making a difference. So,
I totally agree. And I often discuss this kind of with people when I do my antenatal classes. It's a topic I bring up, and all the kind of the partners find it funny, and they think, oh yeah, perineal massage, we'll do that. It's not a pleasurable thing. It's not a kind of nice massage. If you're doing it correctly, it is uncomfortable, because exactly as you're saying, you're kind of trying to stretch your own tissues.
Yeah.
But you shouldn't be doing it to the point when you're kind of wincing in pain. There is a balance to be had somewhere in between.
There's a balance, exactly. And so we're saying the general recommendation is about 10 minutes, 3 times a week. If you can do it a little bit more, I don't know that there's anything that says that you can't, that's fine. But again, you just want to be able to function and not have not difficulty sitting and after effects there. So that's the summary of it. Externally, and then going internally, point pressure and sweeping motions, and breathing. So when you think about having somebody do some deep point pressure, most people are going to tighten up. So that's a key here, is that you're breathing and trying to relax and trying to think about opening the pelvic floor muscles. I'm going to see if I have a little animation of the pelvic floor and what we want to do here. So let's see if I can make it work. The animation isn't working, but I'm going to show you 2 still images. So here's one. It's sideways, but can you see the anus, and then you see the perineum? That hot pink is the vaginal opening. So the perineum there is kind of smaller. And then we look here. Oh, no, that was reversed. So here you have the anus that's smaller, and that's the vaginal opening. And look at that perineum in between the anus and the vaginal opening. And then here, you see how it got bigger. So that's what we're trying to think about. When you have that baby, we're wanting the anus to open. We want the vagina to open. We want the perineum to relax. We want the pelvic floor muscles to relax. We want the perineum to stretch. So that's kind of the summary there. Anything else you think we should add, Brooke?
No, I think we've covered the technique. I don't know if you agree with this, but I also think that don't get too hooked up about which direction you have to go when. I think just alternating, just generally kind of swinging motions and pressure type motions is the important thing, and just that you're feeling a stretch in the right area. And I think your diagrams have been really helpful to demonstrate kind of where you should be pushing. But yeah, it doesn't have to be in a specific order, does it? You just kind of want to make sure you do a little bit of both, a bit of sideways motion, a bit of down motion, and a bit externally as well, just to make sure all those tissues.
And some people can even use 2 thumbs to do it. So you don't have to just use 1 thumb. So that's fine too. And I also want to say this, like, you can do everything that you can possibly do, but you still may tear, or you still may have an episiotomy. That does not mean you didn't do it.
It's not your fault.
That doesn't not your fault. Okay, so this is no guarantee that you're not going to tear and that you're not going to have an episiotomy. And if you do tear or have an episiotomy, it's okay.
Well, exactly. I think this is more just like something that's quite empowering, because, otherwise we just have no idea, you can't do anything, you might tear, you might not. At least this is something you can try to do, and if you can reduce your risk a little bit, or as we kind of said at the beginning, that it may be that you still do tear, but if that tear is a mild tear rather than a bad tear, then you've done something, great there.
Right.
So yes, exactly. It's not your fault whatever happens. I mean, a 9% risk isn't a huge risk reduction overall, and over 90% of women will have some form of tear. So it's not a huge reduction, but it's something that you can do for yourself while you're pregnant and your mind's turning towards the delivery of your baby.
And then if you do tear or have an episiotomy, think about this. You have scar tissue, right? So now you have scar tissue. And if we have scar tissue in other areas of the body, what do we want to do? We want it to move, because scar tissue can get adhered and tight and cause pain. So perineal massage postpartum, generally at the point that you're cleared to begin intercourse, is a great idea if you have episiotomy or tearing. So and a very similar technique. I have a video that you can also reference.
Yeah, we can show that.
Yeah. And then also, if you're having pelvic pain or pain with intercourse or overactive pelvic floor muscles, perineal massage can be helpful with that as well.
Fantastic. Yeah. So these are brilliant techniques. I'm really glad that we've kind of filmed it, and we'll share that with everybody. So
yes, and hopefully at some point I can get an actual animation with a finger.
That would be brilliant.
Yeah, that's a goal. So.
That's a goal, and I can add that into the blog at any time. So if you do get
cool.
that, then we can always add that. But even for now, we've kind of got just on video some of the techniques and demonstrations. So thanks so much.
Yes, thank you, Brooke, so much for your expertise, and I love your accounts, and I love seeing the pictures that you post in your family and everything. It's just awesome. Your content is, and
I love yours too. I'm connecting like this across the world. It's brilliant.
I know. And thank you guys all for joining us. And again, this will be live on my account for 24 hours, and then it'll be on YouTube, hopefully by Monday of next week on YouTube, and then I'll post that in my story, and Brooke, you'll put it on your blog and your story. We'll get it for you guys. Thanks again.
Thanks so much.
Okay, take care. Bye-bye.
Bye.